Hi everyone, I'm coming to you from Newcastle on the lands of the Awabakal people. I'd like to begin by paying my respects to their elders, past, present and emerging, and acknowledge that this was and always will be Aboriginal land. So my name's Ellie, I'm a research officer at Everymind, an institute focused on the prevention of mental ill health and suicide and the promotion of mental health. And this presentation is on how to meaningfully support mental health carers. And it looks at some strategies or the approach that I undertook as part of my PhD research to ensure that the program I was evaluating was novel, needed and relevant, and also impactful for carers and for others in the support sector. So a key part of meaningfully supporting carers is ensuring that supports are novel, needed and relevant. This is important because we don't want to duplicate something that's already out there, but we also don't want to develop something that carers aren't going to use or that they're not going to benefit from. So Everymind undertook a rapid review of the literature to look at current evidence on support programs for mental health carers. And despite depression and anxiety being the most prevalent mental health conditions, there was not a lot of evidence on carers of a person with these mental health diagnoses or with people living with symptoms of these conditions where a diagnosis was not present. So this led to the consultation study with carers of a person with depressive or anxiety symptoms, where we learn about their experiences and support needs, which directly informed a program that Everymind developed for these carers. Additionally, I undertook a systematic review of the literature to systematically ensure that we weren't kind of developing something that was already out there, and also learning about what current evidence there were on similar support programs. And through this study, I found that no current programs existed for carers of a person with anxiety, nor for people supporting someone with depressive or anxiety symptoms where a diagnosis was not present. Another integral part of meaningfully supporting carers is ensuring that the supports that are developed are actually having an impact beyond research. So I undertook a feasibility and acceptability study, which was essentially testing, was this support program safe? Were carers using it? Were they having any issues with it? And did they have any suggestions for improvements? And all of this information was used to adapt the program for a second study, a national randomized controlled trial. Some of the changes to the program included addressing some technical issues that carers noticed, and secondly, adding a social support component where carers could chat to each other in a peer-to-peer type context, which is something they said they needed or wanted. Finally, I undertook a research impact study, which involved working with health economists and finding out what impacts this research had had beyond academia. So, had it improved outcomes for carers? To some degree, we had some evidence of this. Had it had any financial or economic impacts? Well, it did actually contribute to a profit. That is, the investment into the research actually led to an $80,000 profit for the organisation, where they could invest in other programs to support carers, that is, carers of a person supporting a paramedic and of a person who has made a suicide attempt. It also contributed to lots of learnings within the organisation, and we were able to have a better understanding of carers for future research and program evaluation studies. This presentation has highlighted the value of research in meaningfully supporting carers, in that it can identify that supports are novel, needed and relevant, but also research is needed to evaluate programs and ensure that they are having an impact on carers and that they are improving how we understand carers and their needs. Finally, researchers and program developers need to collaborate with services where carers interact to ensure that these programs are available and accessible to those who need them. Thank you.